Good. I'm David Wallinga, Director of Healthy Food Action. Welcome to our 4-part webinar series on food pollution, what clinicians and parents need to know. Today's webinar is on the problems of food packaging. Just a word about Healthy Food Action, which is a 3-year-old network that educates and then empowers U.S. health professionals to then advocate around policies that support a healthy food and farm system. Making sure the webinar runs smoothly today is my colleague, Rachel Gruelle. Today's moderator is Lindsay Dahl. Lindsay helps run Safer Chemicals Healthy Families, a coalition of more than 450 organizations working to protect public health by putting new, stricter limits on toxic chemicals, including those found in everyday products, in the environment, and yes, in food. Before moving to Washington, Lindsay worked with Healthy Legacy in Minnesota, which we're proud to say is the first state in the nation to ban bisphenol A from baby bottles and sippy cups. And now Lindsay Dahl.
Hi, everyone. Thank you so much, David. So my name is Lindsay Dahl, and I'm really excited to be moderating today's webinar for a couple of reasons. First of all, because I've worked with several of the speakers, including David Wallinga and the team at Healthy Food Action over the years, and I think you guys are doing excellent work. So I'm taking a little moment as moderator to say thanks to all the great work that you're doing and hosting these webinars. I wanted to mention a couple of the sponsors for today's webinar. It includes both Healthy Food Action, of course, Safer Chemicals Healthy Families, the Center for Food and Safety, the Alliance of Nurses for a Healthy Environment, and the American Holistic Medical Association. Just a moment for folks to know a little bit about logistics about today's webinar. After each speaker finishes, we're going to have about 10 minutes of Q&A. So if you have any questions, especially while Janet or Shanna are talking, please feel free in the comments on the right-hand side of your screen to enter those questions ahead of time. So don't be shy to get those questions in early so we can have a nice discussion after each of those speakers gives their presentation. So our first presenter is Janet Noodleman, someone that I've worked with for several years now, and I'm really excited to be able to introduce her. Janet directs program and policy at the Breast Cancer Fund, which helps promote breast cancer prevention in state houses and in the halls of Congress. Janet's 25 years of experience in social change includes work as a political organizer, a lobbyist, and a market-based campaigner. It's a pleasure to introduce you, Janet, and welcome.
Oh, sorry about that. Could you all hear me? I think I was muted.
Yes, we can hear you, Janet. Go ahead.
Okay. All right, good. Yeah, I was just saying it's a real pleasure to be here today. And thank you so much for the invitation. This is exactly the right conversation that needs to be taking place. So, just a quick word about the Breast Cancer Fund. We are a San Francisco-based national nonprofit organization focused solely on identifying and eliminating the environmental links to breast cancer, and the only national organization focused solely on preventing the disease. And can you move to the next slide, please? Thank you. I will be providing a broad overview of toxic chemicals in food packaging, and then drilling down more specifically on bisphenol A, which is the poster child for bad actor chemicals in food packaging. And I'm also going to be addressing what healthcare providers can be doing about the problem from both a clinical as well as an advocacy perspective. Next slide, please. Chemicals used to make food packaging, also known as packaging additives, are leaching from cans and other food packaging into food and then into people, exposing in the process our kids and our families to a whole host of unsafe toxic chemicals. The FDA's current framework for approving these chemicals, which are known as food contact substances, has allowed hazardous chemicals to be approved as packaging additives. The U.S. Food and Drug Administration maintains a list of more than 3,000 chemicals and other substances that are approved for use in food packaging and reusable food containers. 2,000 were approved under the FDA's 1958 Petition and Review Program, and about another 1,000 were approved more recently when the FDA's 1997 Food Contact Notification Program went into effect. Both programs are stacked in favor of food and packaging companies and against the protection of public health. Potentially hazardous industrial chemicals or compounds made from them, such as phosphoric acid, vinyl chloride, styrene, phthalates, and formaldehyde, substances with known health hazards including cancer, reproductive harm, and nerve damage have all been approved as packaging additives and are becoming a part of Americans' daily diet without their knowledge or consent. Next slide, please. These chemicals are considered indirect food additives because they migrate from packaging to food to people. In addition, hundreds of chemicals have been approved as GRAS, generally recognized as safe, chemicals, including propylene glycol, which is antifreeze, and propylparaben, which is a known endocrine disruptor that has been found in breast tumors. Thousands of such chemicals, some approved by the FDA as long ago as the 1950s, under a previous regulatory system, remain in packaging despite decades of advances in the science of food and chemical safety. Next slide, please. The most infamous of food packaging additives is bisphenol A. First created in a lab to serve as a synthetic estrogen, the National Institutes of Health have identified food as a major source of our exposure to BPA. BPA is used to make polycarbonate plastics and epoxy resins, which are used to line food cans. BPA can also be found in other types of plastics and in thermal receipt paper. BPA is an endocrine-disrupting compound that has been shown to mimic the hormone estrogen, and exposure has been associated with adverse effects on the developing brain, reproductive system, and mammary and prostate glands in laboratory studies. Next slide, please. In 2013, the Breast Cancer Fund issued a report on prenatal exposures to BPA, which asserts that while it is important to limit children's consumption of canned food, the science is telling us that we need to pay much more attention to protecting women who are pregnant or may become pregnant. During the prenatal period, the foundation is set for how the body's systems develop. The ingredients that go into the complex and delicate development of breasts, organs, and the endocrine system can determine their structure and functions even decades later. Thus, fetal exposures to chemicals, especially to endocrine disruptors like BPA, can set the stage for later life diseases. Animal and human studies indicate that prenatal BPA exposure is linked to a variety of toxic health effects, including disruptions of reproductive organs and mammary development and negative behavioral changes. Next slide. In 2010, the Breast Cancer Fund and the Silas Spring Institute enlisted 5 families to participate in a study of BPA and phthalate exposure from food packaging. For 3 days, we provided fresh food, not canned or packaged in plastic, to each family and asked them to avoid canned food and drinks and meals prepared outside of the home. We replaced their Tupperware with glass Pyrex and their Nalgene bottles with stainless steel clean canteens. We tested the family's urine before and after the intervention for BPA, DEHP, the phthalate most likely to be found in food packaging, and the phthalates DEP, DBP, BBP, and DMP. For the 3 chemicals that measure DEHP exposures, all 3 dropped by over 50% during the intervention. Reductions were even more pronounced for the highest exposures. The highest exposure level in the group of 20 participants dropped about 95% for DEHP and 75% for BPA. For the 3 phthalates not found in packaging, DEP, DBP, BBP, and DMP, we did not see a meaningful decrease in exposures during the intervention. This study was significant because it showed that after only 3 days, people could significantly reduce their body burden of BPA and some phthalates suggesting that regulatory reform could have a meaningful impact on protecting the public health. Next slide, please. To that end, 13 states have already adopted policies regulating BPA in baby bottles and sippy cups, and 4 of those states have gone further by restricting BPA in infant formula cans, baby food jars, and sports water bottles. As a direct result of state leadership on BPA and consumer advocacy, in December 2012, the FDA announced that it would ban BPA from baby bottles and sippy cups, and the following year it banned the use of BPA in infant formula. Legislation to regulate BPA was first introduced in 2005 in California. Since that time, more than 30 states and localities have introduced policies to regulate BPA. The first state to pass a ban on BPA in any product was Minnesota in 2009. This chart shows a list of states that have regulated BPA and the products that are included in their laws. The EU has banned the use of BPA in baby bottles and sippy cups, as has Canada, and most recently France banned the use of BPA in all food containers as of 2015, and from food packaging, infant food packaging, as of 2013. Next slide. Healthcare providers garner great respect in society and can use their power to bring about changes in patient care, clinic, and hospital practices, and also state and federal laws that reduce chemical exposures. Many of you have already heard about TSCA reform efforts taking place in Washington, D.C., but might not know that TSCA specifically exempts the FDA food packaging additives, as well as a host of other FDA-regulated chemicals. 2 members of Congress, however, Senator Dianne Feinstein and Senator Edward Markey, have been working since 2009 to address the dangers of BPA in food packaging. In June of 2013, Senator Dianne Feinstein introduced the BPA in Food Packaging Right to Know Act of 2013, which is a bill that requires labels on consumer food packaging that contains BPA, and also directs the Department of Health and Human Services to finish their safety assessment of food containers with BPA. Senator Markey, in conjunction with House members Grace Meng and Lois Capps, are planning to introduce legislation that would ban BPA from all food packaging and substantially increase the FDA's authority over other food contact substances, directing them to re-review the safety of all previously approved packaging additives and use a higher standard of safety for assessing packaging additives going forward. Next slide, please. A great example of a collaborative effort between healthcare provider associations and environmental health advocates was passed last year, and that was a California law sponsored by the Breast Cancer Fund, ACOG, the March of Dimes, and California WIC that requires the state to inform pregnant women about how chemical exposures can compromise a healthy pregnancy by affecting prenatal development and contributing to later life diseases. The new law expands existing law that requires medical professionals in California to provide pregnant women with a pamphlet on prenatal testing. Now that pamphlet will include an insert about the impact of toxic chemical exposures on prenatal development. The state's Department of Public Health will also send a letter to OBGYNs and midwives encouraging them to discuss environmental health with their patients, including how to avoid chemical hazards. Given all that we know about how toxic chemical exposure can harm a developing fetus, it is absolutely appropriate for healthcare professionals to inform pregnant women about how to avoid dangerous chemicals that can be found in things like food packaging, as well as cosmetics and cleaning products. Next slide. Healthcare providers can also support advocacy campaigns like the Breast Cancer Fund's Cans Not Cancer campaign, which is trying to move the canned food market towards safer BPA-free alternatives. The Breast Cancer Fund launched our Cans Not Cancer campaign in 2011 to increase consumer demand for safer BPA-free cans. While some canned food manufacturers are phasing out their use of BPA, many have not disclosed the alternatives that they are considering or are already using. It is essential that the marketplace have this information so that families can make safer, more informed purchasing decisions, so companies can avoid regrettable substitutions, swapping out one toxic chemical for another, and so advocates can determine if the BPA replacement chemicals that are being used are actually safer. Next slide. The states that have passed policies regulating BPA have been able to count on the support of some influential health associations. For example, local chapters of the American Academy of Pediatrics have supported numerous pieces of state legislation proposing to ban BPA from food packaging. Additionally, in 2009, the Endocrine Society released a scientific statement calling for the regulation of BPA and other endocrine disrupting compounds. This was the first such statement in the group's more than 90-year history and was subsequently endorsed by the American Public Health Association. Additionally, in 2011, the American Medical Association called for a ban of BPA in baby bottles and sippy cups, as well as for stricter regulation of BPA and clear labeling of products containing BPA. In 2013, the American College of Obstetricians and Gynecologists issued a statement on prenatal exposures to chemicals and their links to later life disease. They pointed specifically to BPA as a chemical of concern that should be reduced during pregnancy. Next slide. So what can healthcare providers do? Here's just a few examples. They can adopt hospital and clinic-wide policies to eliminate and reduce exposures to BPA and phthalates through medical devices. Environmental health questions can be added to their standard patient intake forms. This is especially relevant for OBGYNs working with women of childbearing age and pregnant women, including questions having to do with health history, occupational health, diet, including the consumption of canned foods, and purchasing decisions. Healthcare providers can also encourage pregnant and breastfeeding women to avoid canned foods that aren't marked BPA-free. And as I mentioned earlier, healthcare professionals can support market-based efforts, asking manufacturers to voluntarily move towards safer production, and state and federal legislation seeking to more strictly regulate the industry. Next slide. So I've put together a couple of slides, this slide and the following slide, that list a number of resources that I've mentioned during this webinar, as well as some additional resources that I think could be of service to you to help you better understand how to strengthen your healthcare response to toxic chemicals in food packaging and to environmental health more generally. Last slide, please. So the scientific evidence linking BPA and phthalate exposure to adverse health effects is impressive and growing. I think we could all agree to that. But there's always more that we can learn. Despite that fact, however, I want to leave you with the thought that we can and must act now on what we do know. Thank you very much.
Thank you so much, Janet. So folks, just as a reminder, if you look on the panel on the right-hand side, now we're going to allow for about 10 minutes of question and answer with Janet on her presentation. So if you want to take a moment and entering your questions into the panel, that would be wonderful. In the meantime, I know Rachel at Healthy Food Action is going to help moderate our Q&A time. I wonder, though, Janet, if I could take the privilege of being the moderator to ask the first question, if you could comment on the recent article that came out in Mother Jones that was a pretty long expose looking at BPA and replacement, BPA-free plastics and how some of those have estrogenic effects as well. I wonder if you could, answer that question or, speak a little bit to that article.
Sure. So, yeah, this the Mother Jones article was very impressive, and it gave voice to what environmental health advocates have been talking about for the last couple of years. This isn't a new issue for us, but I think it is a new and it's a very scary issue for the American public. And that's this whole question of regrettable substitution. And, all of us were aware, since 2006, really, of the flurry of activity at the state level, demanding that baby bottle manufacturers get BPA out of baby bottles, demanding that infant formula manufacturers get BPA out of infant formula, and that concern was really heated by state legislatures, as I mentioned earlier, who adopted laws to ban BPA from baby bottles and infant formula, 13 states in all. You know, what didn't happen as a part of that equation, however, was the direction to these manufacturers that they not replace BPA with an equally toxic chemical. And some of the tests that were conducted by Plastipure and Certicam and other companies like them have revealed that some of these BPA replacements are just as estrogenic or more than the BPA chemical itself. And that's a real problem. You know, it's the old saying, you know, going from the frying pan into the fire. And that had certainly been the case with these two product categories. And that's something we're really trying to make sure doesn't happen with the canned food industry, who is racing en masse away from the use of BPA and the epoxy resin lining of canned food toward BPA-free chemicals. But the problem is we don't know what those chemicals are.
Thank you, Janet. I'll turn it over to Rachel to moderate some other Q&A. I've got a couple other questions, but I'll let other folks chime in as well.
Great. Thanks, Lindsay. This is Rachel here. Janet, we've got a few questions that have come from the audience. One comes from Jennifer Hartle, and she is wondering, can we trust that BPA products are really BPA-free?
Can we trust that BPA-free products are really
BPA-free?
You know, I mean that is a really good question, and you know, like, so I guess I'm going to say yes and no. I'm going to say yes because manufacturers, the manufacturers that are putting the labels on their products that say BPA-free are credible manufacturers, you know, for the most part. And I don't think that they would want to be caught lying in that regard. I mean, most of you probably know what happened. Remember what happened with Nalgene water bottles? You know, they started talking to the press and saying they were BPA-free, and someone tested their water bottles and found that they in fact contained BPA, and they have since, you know, gone out of the business of providing those water bottles. That was a real problem, PR nightmare for them. So I'm going to say yes. You know, I think those products probably are BPA-free, but I'm also going to say that that there's some real concern about the safety of the alternatives that the manufacturers might be using instead.
Great. Thanks. We've got another question specifically about the research that you did on BPA exposure. And this person asked that research says that BPA exposure is almost exclusively from the diet. Also, BPA is said to be metabolized in 24 hours. I would expect that your dietary intervention participants would reduce their BPA levels even more than 60%. Why would there still be some BPA detected in their urine?
Well, actually, that was just an average, the 60%. I mean, we had, you know, some drops as high as 75% for BPA, and you know, I think the reason for that, we definitely thought about that question. NIH has said that Americans, the majority of our BPA exposure is from food, but it's not the exclusive BPA exposure that we're experiencing, because BPA is in a whole host of other things as well. It's in the CD cases, it's in dental sealants, if you can believe that. You know, it really is all over the place. It's even in some of the machinery, you know, that's used in processing and manufacturing plants. So, so there are other routes of exposure that we couldn't account for and that we don't even know of. That could have been in play.
Great. Thanks. The next question is, alternatives to BPA are also appearing to have estrogenic activity. Instead of regulating chemical by chemical, didn't we instead focus on toxicity, endocrine disrupting activity of chemicals used in packaging?
You know, I just lost you for the second half. Shouldn't we focus instead on what?
on toxicity and endocrine disrupting activity of chemicals used in packaging.
Oh, I love that question. That's such a great question. And whoever asked it must know a little bit about the FDA Food Contact Notification Program, which in fact doesn't require manufacturers to test for those health endpoints. And you know, that's exactly right. I mean, the FDA should be requiring manufacturers to be looking at endocrine disruption as an adverse health endpoint, and if the packaging additives that they're requesting approval of show endocrine disrupting activity, they shouldn't be approved.
Okay, great. So we've got a question from Mary Kelly Sutton, and she's asking, what questions should I be asking patients? What handouts or education materials can I give to my patients on this issue?
So there's a couple of different sources that I would love to direct you to, and one is ACOG, because they have a whole lot of information on their website right now, including some sample intake forms that they're recommending that OBGYNs use. But some of the questions that we're recommending that OBGYNs and other healthcare providers ask their patients is about their occupational health. Like where do they work? You know, what do they do every day? And what kinds of chemicals might they be coming into contact with as a result? But then the other questions they should be asking them is about their personal life. And that is what are the dietary choices that they're making, and certainly if a woman is pregnant or thinks she might be pregnant, you know, we think that physicians or other healthcare providers should be recommending that those women stay away from canned foods, the same way that they would be recommending that those women stay away from sushi and unpasteurized cheese. You know, that it should just be a part of that regular conversation. And this webinar isn't about other product categories, but certainly cosmetics, household cleaning products, paint. Like those are all products that present the same level of concern regarding toxic chemical exposure.
Great, thanks. We've got another question from Sasha Adkins. She says, I've begun hearing about new edible food packaging, but have not been able to find any ingredients lists. Know anything about this?
You know, I am not at all familiar with that, edible food packaging. So I'm sorry, I can't comment on that.
Okay.
But you know what, but let me make one general comment about that. And that is that although, you know, right now food manufacturers are required to label the ingredients in the product in the packaging, you know, so like when you buy Hormel ham, for example, you know what's in the ham besides the ham, the caramel coloring, the cane sugar, you know, whatever else is there. And they're also required to label the nutritional content, the fat content, you know, things like that. But manufacturers are not required to label the packaging ingredients, even though those packaging additives are leaching from the packaging into the food and ending up, you know, becoming a part of our diet. And that is part of the problem, and we think it needs to be addressed legislatively.
Okay, great. So we've got one last question I think we're going to pose to you before we wrap up this portion and move on. But we've had a few audience members have questions specifically about receipt paper, so thermal receipt paper. So one question is, what measures would you suggest to a pregnant woman working as a cashier? And the other states that certain states have banned BPA from their receipts. If that's true, but do most receipts still contain BPA, and does it get on consumers' hands in a meaningful way?
Okay, well that's a really, really great question, and you know, yes, that is a real concern, and a number of states, Lindsay could probably help me out with that question because I'm not sure which of the states have banned BPA from receipt paper, but I know a couple of them have. What would I recommend for a cashier? I would say wear gloves, because BPA is absorbed through the skin, and so that is a real problem for people handling cash register receipts, and we know that it's also as a result polluting our waste stream, because a lot of those cash register receipts end up in recycling, even though they shouldn't, because it's in the thermal processing ink. So that is definitely a real problem. The other thing that I would mention, there aren't that many, but there are a few stores that are actually banning the use of BPA in receipt paper, and one of them is Kroger's. So when you go to Kroger's, you might congratulate them for taking that step, and ask the other grocery stores that you frequent whether or not they have a policy on the use of BPA in receipt paper, and request that they move away from that use if they don't.
Great, thanks. And I think I'm going to turn it over to Lindsay. Lindsay, are you there? Can you maybe respond a little bit to that question, and we'll transition over to Dr. Swan's presentation?
Yeah, absolutely. Thank you, Janet. Wonderful as always. That was a treat to hear you talk about these issues. The one other thing I'd add to your comment about BPA and receipt paper is that a lot of the alternatives for BPA in thermal receipt paper uses a chemical called BPS, which has a very similar structure to BPA and has some kind of early warning signs about estrogenic activity as well. And so that just underscores, for me, the need for us to really take a step back and look at our federal chemical policy to make sure that, when these stores and states start to take action on chemicals, that we're really fixing the root of the problem, which is making sure we have a functioning, comprehensive policy on chemicals to make sure that we're using safer alternatives when we make those switches. So thank you so much, Janet. We're going to turn now to our next speaker, which, again, like I said in the beginning of this webinar, it's a real treat to have Dr. Swan with us. She's an incredible leader in her field, and it's just a real privilege for all of us to be able to hear directly from her today. So Dr. Swan, she's an environmental epidemiologist, and she's a professor at the well-respected Mount Sinai School of Medicine based in New York City. She's nationally recognized for her work on the impact of toxic chemicals on men and women's reproductive health, including infertility, pregnancy, semen quality, as well as other health effects. Really interesting, since 1998, she's been involved in a long-term study looking at how early life exposures of chemicals like phthalates and bisphenol A is having on development and reproductive health later in life. So again, it's a real treat for us to have Dr. Swan here today, and I'll turn it to you to give your presentation.
Thank you very much, Lindsay, and thanks David and Janet for the invitation and the opportunity to talk to you about phthalates particularly, but I just wanted to say we're focusing here, of course, on phthalates and BPA, but there are other chemicals of concern in packaging and in foods, and I hope at another on another webinar you may be able to go into some of those. So I'm going to focus on phthalates, which has been the class of chemicals that I've been concerned about for the past about 15 years. And that's when the CDC pointed out that phthalates are in everyone's body, and there are many of them. And unlike BPA, which is easy to talk about because it's a single chemical, there are many phthalates, and there are actually 8 of them and 11 of the metabolites that are routinely measured by the Centers for Disease Control in their NHANES surveys. So we have to be careful. Next slide, please. When we talk about phthalates, that we can focus on which ones we're talking about. So I'm going to briefly, I have 15 minutes, this is a huge topic, but I'm going to talk just a little bit about routes of exposure and sources of phthalates. And then some of our health concerns, both through prenatal exposure and postnatal, and that would be children and adults. And then I'll talk a little bit about phthalate in food, because that's, of course, the focus here. And there's two kinds of studies. There's the market basket surveys, where they actually measure foods and see what's in them. And then there are the intervention studies. And Janet has talked about one of the best of those, which is very impressive. And then I'll just briefly talk about some precautionary actions. Next slide, please. Yes. So the chemical, the sort of prize winner of all the phthalates in terms of concern, I think has increasingly been clear to be diethylhexyl phthalate, DEHP. This is a large molecule. It's a high molecular weight phthalate. It has many metabolites, and it is the phthalate that makes plastic soft and flexible. So it's in your shower curtain, and it's in this baby in the NICU. And it gets into that baby, of course, through this plastic tubing. And so anything that has soft, flexible plastic tubing, you can assume that it's going to have DEHP in it. Anything that passes through that tubing, particularly if it's warm, will pull the phthalate, which is not bound very strongly to the plastic. It will pull the DEHP out of the plastic, and it will go into your body or into the food that's being processed through that tube. So Janet mentioned that consumers don't have to label what's in their packaging, but they also don't label what's in their foods in terms of unwanted contaminants, such as phthalates. You'll never see phthalates listed on a food package, but we do know that they're in foods. Next slide, please. The second most concerning phthalate, I think, is dibutyl phthalate, which is in hairspray and nail polish, but it is also a component of many plastics and in polyvinyl chloride, as is DEHP. So these two chemicals, DEHP and DBP, diethylhexyl phthalate and dibutyl phthalate, are of particular concern. And one of the reasons is, and many of the problems that come from these are due to the fact that they are anti-androgenic. That means they can interfere with the body's own natural androgen production or transport, such as testosterone is the most common, and they can decrease levels of testosterone both in adults and in children and in pregnant women and in fetuses. And this is probably the clearest action of these chemicals, and the one that's most concerning to me and to many researchers. Next slide, please. So phthalates are found in all of us. That has been shown since about 2000 by the NHANES surveys and by European surveys and Japanese surveys and so on. And they get into our bodies through many routes of exposure. And so ingestion through food and water and beverages is probably the primary one for DEHP, the one we're most concerned about. And on this slide, you see DEHP that enters the body primarily through ingestion. And underneath you see some of the metabolites, because it has many metabolites, and there's 3 listed. And then DBP, our other primary concern, often enters through the skin. It is in cosmetics, which DEHP is not. Other chemicals like diethyl phthalate in cosmetics will be dermally absorbed. Some phthalates can be inhaled as well, for example, through hairspray, through dust. And so these chemicals get in our body through every route possible. Next slide, please. So first, let me say a little bit about prenatal exposure, and I'll have 1 or 2 slides on 2 of these studies, but there are many concerns about prenatal exposure to particularly the phthalates I've been talking about. And by the way, the third one on this slide, butylbenzyl phthalate, is also anti-androgenic. In fact, those 3 that you see on this slide are the 3 most clearly anti-androgenic, lowering testosterone. So there's a study that came out late in 2013 by Ferguson et al. And showed very clearly that DEHP was related to preterm birth. Could we go to the next slide and then come back to this one? Do you think we could just go to the next one? Yeah, great. So this is a figure from that paper, and it's, there's a lot of strange symbols here, but OR odds ratio, and these are confidence intervals. And what you see with that increasing blue squares is the point estimate of the chance that you have a preterm birth if you have levels of DEHP which are in the lowest 25th percent going up to the highest 25th percent. So you have almost a 4 times greater risk of having a spontaneous preterm birth if you are in the upper quartile of DEHP exposure. The upper quartile is not very high. 25% of the U.S. population is in the upper quartile. So we see that this is very strongly related to preterm birth, and this is an outcome that has many consequences for the entire life of the offspring. Could you go back now to the previous slide? And I've been focusing on reproductive tract development, and which is particularly a problem for the male offspring. And we've shown that DEHP in particular is related to how the male develops. And I don't have time to go into the details, but if we go to 2 slides further, if you don't mind, and then we'll come back to this one again. Yes, what we see when the boys were exposed to higher levels of DEHP, I've just lost my screen for some reason, so I didn't get on it, I guess. Sorry. Yeah, I'm back. We see that the boys with the higher DEHP exposure, again in the upper 25% of the population, they had less likely to have their testes completely descended, that is more likely to have cryptorchidism, they had smaller scrotums, they had smaller penises, and then they had shorter anogenital distance. And together, this cluster of outcomes is called the phthalate syndrome. And so what we found was that the phthalate syndrome was seen in humans as well as in animals. So if we could go back then 2 slides. So there are other outcomes of concern in children particularly that may be linked to prenatal as well as postnatal exposure, and that's asthma and allergy. And then neurodevelopment, because the brain is requiring testosterone just like the genitals. And we actually saw changes in play behavior, and 2 studies recently have shown that neurodevelopment, more attention problems, more behavior problems were seen in boys particularly exposed in utero to higher levels of the anti-androgenic phthalates. So if we can hop up now to the adult exposures, or the postnatal exposures. So just flip forward now again, past that, and there we are. Okay, so then if you look at adult males, we see that DEHP is associated with decreased semen quality, particularly in men who are having problems conceiving, and also with altered serum hormones, particularly testosterone. And that's expected because DEHP is anti-androgenic. But also, based on NHANES data, we saw that DEHP, butylbenzyl phthalate, and DEP, surprisingly, was associated with more metabolic syndrome, more problems with insulin metabolism and waist circumference. And then recently, more information is coming out that DEHP can be associated with thyroid problems as well. And this is both in men and in women. Next slide, please. In women, the picture is less clear. Women are not, particularly in utero, girls are not dependent on testosterone for development, and so a decrease is not so concerning. The more there's a concern about the adult female, and the literature is much thinner, but there's conflicting literature about fibroids and endometriosis, some studies showing an increased risk, some studies showing a decreased risk. And there is actually 1 study on breast cancer, and that's for a different phthalate, that's the diethyl phthalate, which is the chemical in cosmetics, which is of concern because that's so widely used. Okay, next slide, please. So as I mentioned, this woman who's trying to see if phthalates are on this package is not going to have very good luck. We have no way to know when these chemicals are coming into our body. I like to call them stealth chemicals, and nobody knows their levels unless they're measured, and nobody knows what's in the products unless that's measured. So fortunately, next slide, please. Before I go to that, let me just say one of the ways that the phthalates can get into our foods is through pesticides. This isn't widely known, but this is a list of so-called inert ingredients from an EPA website. These are inert, meaning they don't kill the pest, but they are, doesn't mean they can't be harmful. And there are many chemicals, including these 4 phthalates that are in pesticides. And they're put in there so that the pesticides will be absorbed by the plant. So they're in there, and so one thing we might talk about is asking people, when possible, when affordable, to eat organic to avoid these. Next slide, please. So the market basket studies are studies which take foods and actually measure the phthalates in those foods. A single phthalate measurement costs about $100. So you can see that this is a very time-consuming and expensive process. Collect the food, measure them out, send it to the lab, pay $100, and then you just get one food. So these are very difficult studies to do, but there have been quite a few of them. They've been all over the world, early ones in Germany, and then China and Belgium, Italy, in the US. And over again, we see that the most common phthalates in food samples are the 2 that we're most concerned about, DEHP and DBP. And as far as which foods have the most of these, it varies, I have to say. But if you go through this literature, you see pattern that meats and processed meats are particularly high, poultry, fish, dairy products, fatty foods. So these are some things that we're concerned about. We don't know enough to say, eat this meat and not this, eat this fish and not that. One of the things I wanted to add was that there's a lot of focus on this webinar on food packaging. If you can buy your food unpackaged and don't process it and don't eat processed food, then you're a long way ahead toward avoiding these chemicals. We did a small study, a pilot study, among the Mennonites who grow their own food and don't process them except to can them themselves and so on. And they had very low levels of both BPA and phthalates. So for those who can, avoid processed foods and avoid packaged foods altogether, you'll be better off. Next slide, please. So there are a number of intervention studies. There's 3 most important ones, and Janet talked very clearly about the Riddell study. I thought it was 20 volunteers, but whatever. That was a very nice study. You heard the results of that, and DEHP metabolites in particular decreased very significantly. In the Temple Stay study, there were 25 volunteers, and they ate vegetables, fresh vegetables, and their DHP metabolites decreased significantly. And then Holger Koch in Germany took 5 adult volunteers who actually fasted. And the next slide shows you the result of that study. So there's the Koch et al. Study, and there's the average for their participants before fasting for DEHP metabolites summed. And so you see that there a decrease over the fasting interval and then a little rise to the post-fasting. It doesn't look very dramatic, but it is a very significant decrease. Next slide, please. So I wanted to just talk about this one study because it points up that we really don't know where along the food chain the phthalates are coming in. Part of it will be the packaging, part of it will be the processing, part of it may be the pesticides that's put on the plants, part of it may be what's fed to the animals. In this study, they took looked for phthalates along the food chain. And this is what I call, or they called also farm to fork study, in which you start at the farm, measure the phthalates, and then each step along the way they measured the phthalates. So at the farm level, they found phthalates in the cattle feed and in the milking process. Think of the machines with the plastic tubing. And then they found phthalates in the contact materials, and they didn't say anything about storage, but what you do in your home matters too, and whether you microwave in plastic and so on. So really what we need is for a number of foods to start at the farm, measure the phthalates, track it through the life of this product until it gets on your plate, and see really what we have to do to get these things out of our body. Next slide, please. So some precautionary actions, Janet talked a lot about this, and there were very good suggestions. I'm saying select unprocessed foods when possible. Processing involves tubing very, very often, or lining of processing materials with phthalates. Avoid canned foods, and DHP is also in canned foods, and you avoid BPA. Buy organic when possible to avoid the phthalates in pesticides. Minimize your meat consumption, and store and heat in glass or ceramic. Next slide, please. I wanted you to see this ad which says that plastics are an important part of your healthy diet. This is made by the American Plastics Council, and if you can read the small print, you'll see you can think of them as the 6th basic food group. I don't think so, and I think this outrageous ad is something we should sort of keep in our mind as something that the American Plastics Council is suggesting. So that's all I have to say. Thank you.
Thank you so much, Dr. Swan. I'm amazed by that ad. I shouldn't be, but I am. So, you know, I think we have a couple of questions, and we've got about, you know, about 8 minutes left. So I want to make sure that we dive into those. The first question I have for you is actually not related to food packaging, but more about phthalates used in fragrance, because I think something that both healthcare professionals as well as myself at Savor Chemicals, a question we get a lot is about phthalate exposure from fragrances and perfumes. And I know that not all phthalate exposure and the health effects of them they're not all created equal. And so I was wondering if you could just shed a little bit of light on, you know, what should we or, you know, patients seeing their physicians be concerned about when it comes to phthalates from fragrances?
So that personal care products, cosmetics, you know, contain a lot of phthalates, and particularly diethyl phthalate and secondarily dibutyl phthalate. And these are highest in products that are fragranced, whatever they are, whether they're cosmetics or whether they're actually soap. I think that people who want to avoid these exposures should buy fragrance-free whenever possible. They don't have to disclose these. So we're getting big doses, particularly of diethyl phthalate, from anything that's fragrance, and particularly perfume. So.
Okay, thank you. I've got a bunch of other ones because the phthalate and pesticide stuff was new to me, but I'll let other folks chime in. So I'll pass it over to Rachel if you want to ask the other questions that are in the queue.
Yep, that'd be great. Thanks, Lindsay. So, Shanna, we have a couple questions for you. The first is, what are the biggest exposures to phthalates from food packaging? Can you give us examples of packaging, like saran wrap, maybe?
Which packaging? So I actually can't do that because I don't study that myself. I'm sorry to be so lame about that. But it will be, I mean, I can tell you which phthalate. It'll be primarily DHP and then DBP, because that's what we find in the foods. But actually where it comes from, it will be something made of plastic. So that's really all I can say. I can't speak to particular brands of wrapping and materials. Sorry. But maybe actually Lindsay might know more about that.
You know, I actually can't answer that question either. Looks like an opportunity for more research, huh?
Yeah.
Absolutely.
But glass, but let me just say glass is a great alternative. Glass.
Right.
Yeah. Okay.
So we have a question from Sam Buesner, and he asks, question is, sorry, when a fragrance product is labeled as phthalate-free, should we be concerned about possible regrettable substitution?
I'm glad you asked that, Sam, because the substitution question is something that really concerns me. And I just want to take this opportunity to say that we did 2 studies in pregnant women, and in the 10 years between those, DHP has come down 50%, which is so dramatic. And that's because of the actions of groups like this, and I think it's and consumer choice was, and manufacturers listening. So that's great. But whether they're actually what the substitutes are, I am actually concerned, just as Janet is with BPS. We have some evidence that the substitute for DHP, which is one of those is DINP, may have similar anti-androgenic properties. We need to do something like REACH, where in Europe, where chemicals are proved safe before they're marketed, not after they show harm.
Great, thank you. We've got a couple questions here from audience members that are concerned about the pesticide issue. So one question is, if phthalates are used to bind pesticides to the plant, are they used in other products for the same purpose, like cosmetics?
Yes. Yes, that's why they're put in cosmetics, to increase absorption. It's the same action. And so, you put some cream on your skin and it's gone, right? After a while, on the table it won't be gone, but on your skin it'll be gone. That's because it's absorbed. And the phthalates help that absorption. That's exactly right. So you should be concerned.
Interesting. The second question on pesticides is, I didn't know that inert ingredients in pesticides can still harm humans and be called inert.
Yes.
What attempts at regulating phthalates in inert pesticide ingredients have occurred, or any attempts at changing the definition of inert?
That's a great question. I don't know. I mean, inert just means they don't kill insects. It doesn't mean they're safe. And there, if you look at that list of chemicals, if you go to the inerts in pesticides, you can Google that and you can see lots of nasty things that are, and either toxic or where there's concern for toxicity, that are put in pesticides.
We've got another question here. Why do you think dairy products have the highest level of phthalates?
I don't know that they do have the highest level. They're among those with higher levels. And I suspect it's the phthalates in the processing, in the milking machines, in the whatever, that we need that study. There's this one, which is interesting, Furans, you can read that. And by the way, if people want to know, get specific references or PDFs, I have my email address on my first slide, and you can just email me and I'd be happy to send you references. But there's just so much we don't know. And, milk, dairy products, fatty foods, milk, meats, fish, they're all have phthalates in them.
Great. I think we're going to just do one more question before we have to wrap up the webinar. We're reaching kind of the end of the hour here. And this one is specifically, it looks like, about alternatives to phthalates and as plastic.
Sorry?
And are they safe? Eco-plastic materials.
Yeah, so for example, potato-based plastics and grain-based plastics and, corn and so on. And I think they're not going to have phthalates in them. And I don't know, I've not seen results of their being tested for other chemicals. I don't know what they cost in terms of the energy to create them, but I think it's a good direction.
Okay, great. Thanks so much. I'm going to turn it back over to Lindsay to wrap up, but we really appreciate you being on our webinar. Thanks, Dr. Shan.
Thank you.
Yeah, thank you, Dr. Swan. It's been a pleasure. And thank you so much for Rachel and for Dr. Wallinga for hosting this wonderful webinar. I wanted to let folks know that today's webinar will be archived and it'll be featured on the Healthy Food Action website. So please check out the website at healthyfoodaction.org for additional resources and links, as well as the archive of this webinar to share with your friends and family. I want to make sure that folks also have the next food pollution webinar on their schedule. It's scheduled for April 17th. And it's on a topic that I'm really interested in about. It's titled The Tricky Case of Triclosan, which is talking about the pesticide triclosan, which is used in antimicrobial products like toothpaste, soap, and other products like that. So make sure to mark your calendars for April 17th and sign up at healthyfoodaction.org to make sure you get on that. And it's actually going to feature another well-regarded physician, Dr. Sarah Jansen, who's at the UCSF School of Medicine, and Beth Schenke, I hope I'm saying her last name right, a nurse who's spearheading an effort to get triclosan out of her local hospital. So with that, I think that's all I have for today. Rachel, I don't know if you have anything else before we wrap up today's webinar.
Nope, that's all. I just want to thank everyone for their participation, and we hope to see you on our next webinar. Thanks so much.
Thank you. Bye-bye.
Bye.